fatalities are people of color. In Chicago, we heard the mayor say more than 70% in that city. Your response to that, and should the CDC or the federal government be tracking this virus demographically to warn people?
Well, absolutely. The CDC and the federal government should be and are tracking this virus and trying to break it down by different demographic groups so that we can help people understand. But my office, long before COVID-19, has been talking about health equity, has been talking about the need to help people understand when they're at risk and to actually intervene. And when you look at being black in America, number one, people unfortunately are more likely to be of low socioeconomic status, which makes it harder to social distance. Number two, we know that blacks are more likely to have diabetes, heart disease, lung disease, and I shared myself personally that I have high blood pressure, that I have heart disease and spent a week in the ICU due to a heart condition, that I actually have asthma and I'm pre-diabetic. And so I represent that legacy of growing up poor and black in America, and I and many black Americans are at higher risk for COVID. It's why we need everyone to do their part to slow the spread.
So, Doctor, I imagine that it's frustrating for you to hear those numbers, 70% of the dead in Louisiana, people of color, African Americans. Is there a particular recommendation you have for that community?
Well, my recommendation is to understand that you are at risk, you are not immune, and my recommendation is to all of America that we're really doing this to protect not just ourselves, but each other. Every single person who stays at home, whether you're white, black, brown, or yellow, is a person who is not spreading COVID and is a person who can protect their neighbors. When you wear a cloth facial covering, if you go outside, you're doing it to protect your neighbor. Now's really the time for us to come together and say, look, I'm doing this not just for me and my family, but I'm doing this for my community and all the communities across the country, and it is working. We will get through this. We are seeing progress, but America has the power to change the trajectory of this epidemic. The public really needs to keep doing their part.
All right, Dr. Jerome Adams, thank you very much for being here. Gail, you heard him say it breaks his heart. A lot of broken hearts in this country right now. What do we have coming up next?
I know, Tony. I actually call it an equal opportunity.